What if I told you that the last time a medical cure was discovered was before man ever set foot on the moon? Yeah, I know, and we can cover that in a future episode. The last true medical cure was discovered before man ever set foot on the moon, and that's not by accident. Because in the world of medicine, cures don't make money. Patients do. And the perfect patient is the one who never gets better. Let's take a look. Let's rewind to the 1950s and 60s, the golden age of public health breakthroughs. We cured smallpox. We nearly wiped out polio. Penicillin revolutionized infection treatment. These weren't just band-aids, they were real, permanent solutions. But since then, nothing. You don't hear about cures anymore. You hear about management, maintenance, and long-term treatment plans. Because the moment we started treating healthcare as a business, healing became unprofitable. Think about it. A cure is a one-time transaction, but a lifelong prescription? Now that's making money. In 2022, the U.S. pharmaceutical industry made $635 billion in revenue. That's 1 year. Nearly 80% of adults in America are on at least one prescription drug, and 50% are on 3 or more. That's not health care, that's a subscription model. You're not a patient, you're a subscriber. Now, some might argue that we've made huge strides in medicine. And sure, we've gotten better treatments. We've extended life expectancy. We've got better diagnostics, better technology. But curing something? Where's that? Take cancer. We've thrown trillions into cancer research. But the war on cancer was declared in 1971. And here we are, over 50 years later, still offering the same treatments: surgery, radiation, and chemo. Sometimes they work and sometimes they don't. But all of them are highly profitable. None of them are cures. Same goes for diabetes, heart disease, depression, Alzheimer's, lupus, asthma, arthritis, even the common cold. So where are the cures? And here's where things get a bit uncomfortable. You don't need a conspiracy when you have an incentive. Pharmaceutical companies are publicly traded entities. Their fiduciary responsibility isn't to heal you, it's to increase shareholder value, to make money. That means raising prices, extending treatments, maximizing prescriptions, and lobbying against anything that threatens the business model. In fact, Big Pharma spends more on marketing and lobbying than it does on research and development. Think about that for a minute. They invest more into selling you the drug than discovering a way to make sure you don't need it at all. Well, here's a stat that should bother you. The top 10 pharmaceutical companies in the United States made over $100 billion in 2022 alone. Meanwhile, 66% of all personal bankruptcies in the U.S. are tied to medical debt. Even insulin, discovered over 100 years ago, was supposed to be free. The original patent was sold for $1. But what about now? Some diabetics in America pay up to $1,000 a month just to stay alive. That's not medicine, that's extortion. Let me ask you something. If you're a pharmaceutical executive and you find a cure for a chronic condition that affects millions, do you release it or do you shelf it? Because if you cure the condition, you kill the cash cow. That's why research gets funneled into treatment, not cures. There's no money in healthy people. Well, here's a name you probably haven't heard before: John Kanzius. He wasn't a doctor, he wasn't a scientist, he was a radio engineer. And in his own garage in a small town in Pennsylvania, he may have discovered a revolutionary way to cure cancer cells without chemo, radiation, or surgery. If that sounds too good to be true, buckle up. Kanzius was diagnosed with leukemia in 2002. Watching children suffer through chemotherapy broke his spirit.
I think when you get diagnosed with any form of cancer, you're immediately can't believe that you're the one that fell off the boat.
So he asked, could radio waves, the same invisible frequencies we use to transmit sound and data, be used to kill cancer?
I thought, God, I wonder if there's a way of using heat and radio waves to kill cancer cells. And that was about 4 o'clock in the morning, and I was getting nauseous, but the next day it did not leave me. I woke up with it, and I had another chemotherapy session, and I thought about it all day, and then came back that night and started playing around with radio waves.
He then built a device, not complicated, just high-frequency radio waves focused on a specific point. But here's the magic. He paired it with microscopic metal particles, like carbon nanotubes, which were attracted only to cancer cells. So when the radio waves hit those particles, they heated up and cooked the cancer from the inside without harming healthy tissue, like a sniper shot instead of a carpet bomb. As of April 2007, preliminary lab research was underway at MD Anderson Cancer Center and the University of Pittsburgh Medical Center. The results were promising. Scientists found it could shrink or eliminate tumors in animal models. Human testing was next, pending federal approval. And then, silence. Ask yourself, how many people have claimed to have found an effective treatment for cancer? And how many of those people have been crushed by the system? John Kanzius died in 2009 from complications of leukemia. His device was never brought to human trials, and the multi-million-dollar chemo market, untouched. Think this was a coincidence? When disease gets treated as a commodity, even hope becomes a threat to that business model. So you might be wondering, well, where's the accountability? Where's the regulation? What about the truth? Well, the watchdogs have all been bought. Roughly half of FDA advisors have financial ties to drug manufacturers. It's the same people approving the drugs and cashing in on their approval. Conflict of interest isn't a glitch, it's a feature. You're probably thinking, I know my doctor, and my doctor would never push something that wasn't in my best interest. Well, the problem is they don't have to push it because the system does it for them. And your doctor, they're part of it. Between 2013 and 2022, drug and device companies paid out over $12 billion to U.S. doctors. Not to hospitals, to individual doctors. About 57% of all licensed physicians took something, whether it was a free meal, honoraria, or a check with a few too many zeros. And those payments, well, they work. Doctors who receive payments from a pharmaceutical company prescribe that company's drug 58% more often on average. Not because they're evil, but because the system rewards those who comply and sidelines those who don't. It's really just that simple. One orthopedic surgeon made $4.8 million in just a few years. Cardiologists, psychiatrists, neurologists, all among the top recipients. Even family doctors are getting thousands to recommend specific drugs. And while most payments are small, the influence is anything but. Now ask yourself, if your doctor gets paid more when you stay on a drug and nothing when you get off it, how do you think that influences what they prescribe? This isn't a conspiracy, it's a business model. It's not about bad doctors, it's about bad incentives. The moment healthcare became profit-driven, your health became secondary to the system's survival. And the longer you stay sick, the longer they stay rich. So even if your doctor's caught in the profit web, where does that leave the rest of us? Let's talk about what we can actually do. So what do? Do we boycott medicine? No. Modern medicine saves lives. But the system around it, it's predatory. We need transparency, accountability, incentives for real cures, and education, not just on disease, but on the industry behind it. You don't fix a broken system by trusting the ones profiting from it. So here's the part that sticks with me. What if we already had the cure for cancer? What if somewhere, somehow, somebody figured it out? Would we ever even hear about it? Or would it vanish somewhere in a boardroom buried under layers of profit, patents, and NDAs? That's the danger of a system that puts dollars over lives. So the next time your doctor hands you a prescription, ask yourself, is this medicine or is it maintenance? Because when illness becomes a business, health becomes a liability. And in this system, you were never meant to get better.